Hello, everyone. I'm Michael Jones, president of the Medical Exercise Training Institute. I want to spend just a few moments talking about the idea of medical exercise training being integrated into value-based care programs or programs that are following that concept. Now, the Medical Exercise Specialist Workshop and Certification was started back in 1994. Myself and another physical therapist realized with the cutbacks we were seeing in healthcare, many of our patients were being discharged earlier than we thought was necessary, but dealing with insurance carriers, there wasn't really much we could do. So we felt like we needed an individual, a fitness professional, that had the ability and the understanding of clinical anatomy and pathology that could develop safe and effective exercise programs, as well as communicating directly with physical therapists such as myself and physicians, so that now we could have someone in the community that could provide safe and effective exercise programming after discharge from physical therapy. Well, it's 31 years later. And now, with those 31 years later, we have thousands of medical exercise specialists around the world, and we're starting to see a shift in healthcare toward more value-based care. So we're going to talk a little bit about the idea of medical exercise training being integrated into the value-based care model. The value-based care model is a little bit different than what we've seen traditionally in healthcare, in that the value-based model is not based on paying a provider for services, but paying providers for outcomes, and those outcomes that are positive and make the client more functional, as well as making the client healthier and avoiding regressions or readmission to medical services. So with that, medical exercise training is no longer an option. We're seeing more and more medical exercise training is becoming essential to healthcare, so the client doesn't regress. We also are seeing medical exercise training is not simply post-rehab maintenance, but clients are getting better with medical exercise training, and medical exercise professionals are producing positive functional outcomes for their clients. There's a rising demand from hospitals, physicians, insurance carriers, therapists, and even clients that are saying, we want something for these individuals after physical therapy and chiropractic care is over. Now, let me make sure you understand. Medical exercise training nor medical fitness training was ever designed to take the place of the physician, the therapist, the chiropractor, but we all now live in this world where insurance reimbursement is being cut, so we need a safe and effective method of managing these clients after therapy services are over. So with value-based care, or VBC, we're going to see changes everywhere. As I said, the traditional model was more visits meant more reimbursement, but the new model will be based on the idea of paid outcomes, or being paid for outcomes, not being paid for just simply activities. And medical exercise training fits into that very well because it's non-invasive, it is cost effective, and if we as medical exercise professionals start to be more cognizant and utilizing functional outcome measures to measure the client's improvement, this will be vitally important in the medical community, as well as clients, healthcare providers, insurance carriers starting to realize that exercise truly is vitally important in managing chronic medical conditions. So the key is the medical exercise professional, medical fitness professional, has to make the transition from technician to outcomes provider. Now, I know a lot of you say, well, I'm certified, Dr. Mike. I'm not a technician. If you're focused on simply the exercise itself and not the outcome the exercise is producing, then you're an exercise technician. If you're more concerned of how long, how often, how much, what exercises, how do I progress this client, what are the actual functional goals for the client, that means now you're looking at the idea of being an outcomes provider. So that means, as an outcomes provider, functional goals drive each and every training session. We need measurable progress to be tracked on an ongoing basis. We need clear documentation that will give you more credibility with the medical community, the clients, as well as the insurance industry. And client education becomes important because, remember, the doctor, therapist, or chiropractor only may see that client once or twice, where you're seeing the client on an ongoing basis. And we're going to see medical exercise professionals will have to work closely with healthcare teams regarding their clients' outcomes and their overall health and wellness. What this means for your practice, if you're a medical exercise or medical fitness provider, is more referrals from value-based providers. They're looking at this idea saying exercise can help with this, and we know exercise is the key to long-term management of most medical conditions. There will be potential for bundle payments from either clients, insurance carriers, or employers, and insurance carriers may start paying for this, And we may also see outcome tracking will become mandatory. No more can you just simply say the client is getting better. You have to have measurable factors you're looking at, or what we call functional outcome measures, to say, yes, the client is getting better. This will cause the medical exercise or medical fitness professional to gain invisibility across the healthcare spectrum, which means you'll get more clients as a result of this. There are a couple of tools we recommend: our Advanced Medical Exercise Specialist Manual and our Cracking the Code Manual. The Cracking the Code Manual will help you deal with insurance carriers and also help you with the idea of developing the administrative aspects of your practice to deal with doctors, therapists, and chiropractors, as well as insurance carriers. And then our Advanced Medical Exercise Specialist Manual gives you protocols, guidelines, procedures, everything you need to set up a professionally run medical exercise training or medical fitness practice. This is your moment. And the moment here is, it's not about exercise. It's more than exercise. It's about functional healthcare. So if you would, please go over to Medical Exercise Specialist blog or postrehab.com to get more information. And if you look down below this video, if you're watching this on our website, you'll see a link where you can actually download the two manuals, the Cracking the Code Manual and the Advanced Medical Exercise Specialist Manual, at a special price. If you're watching this out on the internet, go over to postrehab.com to get more information and click the link for the blog to learn more about value-based care and how medical exercise training can fit in. Again, go over to postrehab.com or look at the link down below to get more information on medical exercise training and being integrated into value-based care. Thanks again, folks. Let me close with saying this. When we started this 31 years ago, we had no idea it would last 31 years. Healthcare changed, our society changed, and we're seeing more and more seniors in the healthcare system with chronic conditions. Our healthcare system is undergoing changes, and one of these changes is the movement toward value-based care. Exercise is an essential component of that. You as a medical exercise or medical fitness professional have to make the next step and move from technician to outcome-based provider. And that's what we do here at the Medical Exercise Training Institute. So check us out at postrehab.com or look at the link down below and get those two resources. I guarantee you they'll be a big help in helping you make that transition from just simply medical exercise professional to outcomes provider. Thanks again. We look forward to seeing you on our blog. If you have a question for me, email me at drmike@postrehab.com.